Hey, Dr. Kyle here from Shifts. I wanted to talk today a little bit about neck pain and some of the common things that we see and things that we look for when people come in for an evaluation to figure out what's going on with their neck issues. So a couple things that we look for from a chiropractic biophysics standpoint is the curvature in the neck, which we call the lordosis, and then the head posture. So is the head right over the shoulders as it should be, or is it starting to fall forward like that? Okay, so those are the things we look for, and we actually use special computer software so we can analyze x-rays and measure down to the degree in the millimeter, and we can measure all of those things out. Now, a cool thing is that everything we do is based on research, and so based on research, there's essentially two cut points that we look for where we know someone would be, quote unquote, in danger of having chronic neck pain or chronic neck issues. One of those is having a 20-degree cervical curve. So if we look at this poster here, we should have this nice curvature throughout. What we see a lot of times often is right here where people have lost the curvature and they've fallen forward. So that line is where we should be, and that's where we've gone. Now, we know based on research, like I said, that if we are 20 millimeters forward from the top of our neck to the bottom of our neck and we're coming forward, that is a cut point that tells us we have a high likelihood of having chronic neck issues. So guess what? Our goal for people who come in is to get them under 20 millimeters of forward head posture. And we measure these things before and after our care to make sure that we actually did them correctly. The other thing is the curve in the neck. So the cervical curve, like I just mentioned, ideally that should be around 40 degrees. But what research tells us is as long as we're over 20 degrees, we're gonna be in a pretty good spot in terms of chronic neck pain and not having to deal with it. So we know if we're under 20 degrees, we're more likely to have it. And we know if we have a straight neck or even a reversed curve in the neck, we're at extremely high likelihood of chronic neck pain for the rest of our life if we don't get that corrected. So those are things that we measure upon initial evaluations. We also measure them after we perform our care so we can check and make sure that we're correcting things and making sure you're set for the long term so you're not having these issues over and over again.